Good morning, everybody, and thanks for being with us on KXAN Live. I'm Will Dupree coming to you from the KXAN Live studio. We appreciate you being with us. Right now, we are going to go to a news conference that's happening live at the Travis County Medical Examiner's Office. Judge Andy Brown is going to kick things off, and what they're going to discuss is the ongoing health crisis that they wanted to talk about related to drug overdoses. They're going to share information about the medical examiner's report looking into deaths from 2022, particularly those caused by fentanyl overdoses. Let's listen in as Judge Andy Brown gets things kicked off there at a live news conference.
Pickard, for hosting us here today and for all the work that you do. We're going to go through a few of us will say something, and then at the end during questions, Dr. Pinkard will be available for questions. Dr. Pinkard and his team, Beth, everybody at the medical examiners does such an amazing job, such a professional job. They have finished compiling their report for 2022, and it's helping us understand what is happening in the community so that we can respond accordingly. Today we're going to discuss the data in the 2022 Annual Medical Examiner Report, which includes information about gun violence, suicides, child deaths, and the focus of this news conference, which is accidental overdose deaths. In the 2021 Medical Examiner Report, we saw a historically high number of accidental overdose deaths, particularly where fentanyl was involved. In 2022, that is still true, and the problem has grown significantly worse, despite significant work across our community. Last year, 245 people died from accidental fentanyl-related overdoses, with a total of 417 accidental overdose deaths. Overall, the number of overdose deaths are up 35%, and accidental fentanyl-related overdose deaths are up 108% in 2022 over 2021. Numbers don't lie, and these statistics deliver a sobering truth about what's happening in our community. The number of people who died of a fentanyl-related overdose doubled from 2021 to 2022 in Travis County, and it has increased tenfold since 2019, from 22 deaths to 245 deaths. Travis County is facing double the number of funerals, double the number of empty seats at the dinner table, and double the number of families with more questions than answers. This is and this continues to be a significant threat to the public's health and safety. We're fighting an enemy who strikes at will and does not discriminate. Data from the medical examiner backs this up in the trends of who is dying from fentanyl overdoses. The number of women who died of an accidental fentanyl-related overdose increased 191%, from 24 in 2021 to 70 in 2022. The number of black people who died of an accidental fentanyl-related overdose increased by 460%, from 5 in 2021 to 28 in 2022. The number of Hispanic people who died of an accidental fentanyl-related overdose increased by 247%, from 19 in 2021 to 66 in 2022. It's clear this public health crisis isn't impacting an isolated group of people. Overdoses affect everyone in Travis County. These are people, these are our families, our friends, our coworkers, and we need to continue investing in dignified solutions that work. Last year, the Travis County Commissioners Court declared drug overdoses a public health crisis and invested $350,000 into harm reduction measures. That money is going towards engaging directly and learning from the people impacted about how best to address this crisis, increasing access to life-saving resources for our community partners, and increasing awareness about the dangers of fentanyl. We're now working to get additional help. My office will also be asking the Commissioners Court for $750,000 in the fiscal year 2024 budget to create an overdose prevention fund, which includes recommendations from the Texas Harm Reduction Alliance. You'll hear from them shortly. The funding would go to building a more robust response for emergency community needs, expanding critical infrastructure for organizations, engaging in outreach and recovery, and having a county to tap into during emergencies. Additionally, we're calling a meeting in the coming weeks with public health officials from the city and the county to see what we can do immediately to help community organizations stop this trend. We'll talk about the status and effectiveness of current local programs and how we can further target resources to save lives in Travis County. Travis County, in collaboration with community stakeholders, will decide how to invest the initial disbursement of $1.4 million in opioid abatement funds. And while these are great steps for us at the local level, we need more investment from the state. In 33 days, the Texas legislature will finish their work, and I'm calling on all of our representatives who care about harm reduction and the mental health of our community to make sure that the state does more. We need the state legislature to fund more mental health options for people, including the $2.3 billion that is currently earmarked in the budget to increase spending on mental hospital inpatient capacity. Other helpful bills include House Bill 479 from Representative Gina Hinojosa, which would reimburse counties housing individuals waiting for a state hospital bed, something we need desperately to address the intersection of mental health and harm reduction. In terms of harm reduction, House Bill 362, legalizing fentanyl testing strips, passed in the House, but it's still waiting for a hearing in the Senate. Let me be clear, this bill is necessary. This change in the law is necessary. It's not nearly enough alone to solve the problem, but it is necessary. We can't let politics get in the way of saving lives. Overdoses in Travis County, overdoses in Texas are not a partisan issue. In closing, the data I shared today is just one part of the 2022 annual report. I would encourage you to read the whole report. It's got graphs, very easy to read, very informative. It will be online. I think it may already be online and available. Next Tuesday, the medical examiner will provide a detailed briefing to the Commissioner's Court that will cover all of his findings. They'll cover the data about suicides, gun violence, and other key points, and I hope that you can join us next Tuesday. Thank you so much, and I'll pass it now over to my colleague, Commissioner Jeff Trevelyan.
Well, good afternoon. I guess it's still morning, so good morning. Just want to talk for a moment about how important this really is. We can talk about statistics and we can talk about any number of things, but my family is a family that has suffered loss because of addiction issues. It is really important to begin to identify problems as early as we can. It is really important to start giving folks a fighting chance to understand the issues of addiction and how they have long-term and short-term consequences. I lost someone very close to me. For me, it was my older brother, and he had an addiction issue, and he understood that there was an issue, but did not get the help and the support that he needed until he needed the liver transplant. And what we have to do is recognize that we're not only impacting quality of life, but we're impacting all of the families in the community that are touched by this issue, because when you lose a family member, it impacts everyone. So what we know is that we can provide more options. What we know is that we can provide more beds. We know that we can provide more resources, and we're committed to working together as a team to get that done. I just repeat, all of us, if our families are large enough, have been impacted by addiction and the issues that surround it. But we can develop a process as a community. We can develop strategies as a community. No one single thing will do. We need a number of opportunities, need to take advantage of a number of opportunities. We're looking in other communities to see what's working. We have talked to folks in Nashville, we have talked to folks in Tucson, we have talked to folks in Miami. We're trying to find the best practices that are on the ground. But at the end of the day, when we put these resources together, it is to build and protect community. And that's why it's so important for us to educate the community about what is really at stake. The statistics are terrible. We see tenfold changes in deaths just 2 or 3 years ago. But the most critical thing is, if we are going to get the community that we deserve, if we're going to protect the family and community members that we have, it's going to be because we build these processes together. So we want to make sure that you understand that we are completely committed. We're going to work together to put best practices in place. But what we need is the support of a community that has the same goals that we do. Thank you.
Thank you. Sheriff?
For your Travis County Sheriff's Office, the battle against fentanyl is about education and enforcement. We're partnering with local school districts to educate parents about fentanyl and how easily students can get it. We're also making them aware of misinformation students circulate about the deadly drug. In just a few days, TCSO will be launching an awareness page on our website that includes testimonial videos from parents who have lost their children to fentanyl. It's powerful to hear their stories, especially now that we know fentanyl-related overdoses have increased from 38% of all overdoses in 2021 to 59% of all overdoses in Travis County in 2022. Travis County, the site is also going to offer some very useful resource links. As for enforcement, TCSO currently has a number of active investigations into fentanyl overdoses, and we're going after the dealers, and we're working with local law enforcement agencies as well as the DEA. Saving lives is our top priority at TCSO. Thank you.
Thank you. Dr. Desmar Walks, our health authority.
Hello, I'm Desmar Walks, Austin Travis County Health Authority and APH Medical Director. I want to thank Judge Brown and Commissioner Trevelyan and all the committed public health servants that are here today, and community stakeholders who are working so hard and to fashion processes and programs in our community to help save lives. APH is committed to monitoring infectious disease, biohazards, and injuries and deaths. And today I'm here to talk about a poison that's in our community that's taking the lives of our loved ones. There's been a dramatic increase in overdose deaths, as you've heard, but particularly an increase in fentanyl-related deaths. And we are committed to deploying resources to expand peer support training and counseling to our stakeholders in the harm reduction arena, and to increasing the resource of Narcan, which is a life-saving drug that we have been putting into our community and training our community members to use to save lives. We've developed a campaign, One Pill Can Kill, in conjunction with Travis County, Central Health, Integral Care, and it is going to help increase awareness in our public about how this drug and other drugs can so easily be obtained and so easily destroy lives as we know it. In our last press conference, the judge said drug addiction should not be a death sentence, and I took away from that conference a renewed commitment to make as much information available as possible to our public, to educate them on how to have the conversation, how to normalize the conversation about drug addiction, and how to expand that conversation to talk to our loved ones and our children in particular about mental health issues. We have a stigma in our community, across the community, when it comes to mental health and to addiction, and we need to change that. We need to make that conversation more common and more welcoming, and let people know that we have the resources here in our community to help them. I want to close by saying that the House bill that has been passed to legalize fentanyl test strips is important, and we really need that to be passed. We need our community to support that. We need to support our friends and loved ones who are struggling with addiction, and we need to get past this, and we need your help. Thank you.
Got Kate Graziani from the Texas Harm Reduction Alliance.
Thanks. Good morning. As the judge said, my name is Kate Graziani. I'm here with the Texas Harm Reduction Alliance today. And I want to start by being a little vulnerable because I'm devastated and angry about the numbers that we're discussing today. I appreciate that we are shining a light on this issue finally and giving it the attention it deserves, but we do not have to be here. We have been sounding the alarm on overdose deaths and fentanyl for many years and calling on public health strategies to fight these deaths. And I'm angry because every overdose is preventable with information that's rooted in harm reduction that goes beyond a one pill kills message. With drug checking tools like fentanyl testing strips and Narcan widely available, we can save lives. So we know how to do it, and yet we're still seeing more than double in our overdose deaths in our community. The opioid settlement funds that the county and the city have recently received are a unique opportunity to change course and do something meaningful so that we are not here again next year discussing another doubling, another hundreds of folks we have lost in our communities. We have to put city and county resources towards this through a coordinated effort, a work group, an advisory group, but it needs to be led by harm reductionists and people who understand how to implement an overdose response strategy. We have to immediately make drug checking tools available in our community. That would help, or what would help is if the state would legalize fentanyl testing strips and other drug checking tools, but we cannot wait for the state to understand how to save the lives of Travis County residents. We must be providing harm reduction at every level. Culturally appropriate, age-appropriate harm reduction services at every level can and will save lives, and harm reduction programs need to be authorized immediately. We can save lives if we have the resources and the infrastructure to do so. We also know that punitive strategies will not work. I want to call on us to think about why our sheriff's office is educating young people about a public health risks related to drug use. We need public health, mental health professionals to be involved in education and overdose prevention with our young people, not law enforcement. We also have DPS here in Austin, increasing drug enforcement, arresting more and more folks, causing harm in our community when we need public health strategies. We need methadone and Suboxone, we need detox, and we need housing options for people. We need to stop the sweeps of encampments and stop the use of punitive strategies altogether and shift course into a harm reduction approach that will work. If you want to save lives, we have the tools. We need the support from everyone here who spoke today and everyone in our community to get behind this. We're about to come up on our 1-year anniversary of passing, of declaring this a crisis in our community. And before we pass that anniversary, which is coming up in a month at the county, we need a plan. We need a city and county overdose response plan that is led by harm reduction efforts. We need action now. Thank you.
Thank you. Up next is Darren Acker with Communities in Recovery.
Thank you, Judge Brown and Commissioner Trevelyan, for inviting us here today. My name is Darren Acker. I'm the Executive Director at Communities for Recovery. We are one of the organizations that was funded to provide peer recovery coaching services with county funds late last year. And Communities for Recovery is a nonprofit organization in Austin that provides peer-based services to people dealing with substance use and mental health, co-occurring mental health issues. We provide peer-based services, which is services provided by someone with lived experience who has been there and gone through the same experiences that the people that they're working with and supporting. This service is a critical part of the response to the overdose reversals or overdose crisis. We're able to go in and meet with somebody and connect with somebody like no one else can. And we become a part of the team that supports those individuals in addressing their needs. I have Sean here, who is a peer recovery coach and is actually doing this out in the field right now. I'm going to let him talk in a little bit, but we are out there right now at 15 different sites. And as you can tell, that's still not solving all our problems. It's still not addressing the issue the way we need to. Part of the issue is that for 15 sites means 15 different funders and 15 different streams and 15 different objectives. And as someone said to me once, it's death by 1,000 contracts. We need some consistency here in terms of our funding and some guarantees that funding will continue on past a year, 2 years, or 3 years. It's consistency and long-term engagement that makes a difference in the problems that we're addressing. Also, I agree very much with Kate. We have to have a plan. We have to have outcomes that we can measure and that we're held to those outcomes and those expectations of what we're trying to achieve. So that, again, next year, we're not facing the same issue. We actually are showing a reduction in deaths. We're showing a community that is actually more supportive of people who use drugs, more supportive of people who are recovering from substance use, and more supportive of our community. Because it's through connection and it's through community where we save people's lives. Narcan is extremely important. Harm reduction is extremely important in this. But you need to develop trusting relationships with people. They need to trust their community. They need to feel like someone cares and that they're part of the community. Otherwise, it goes and remains in hiding, and we don't know what's going on, and we don't have access, or people don't come out and ask for help. As someone who has friends and family who have dealt with and experienced an overdose, the one thing I know is using alone is extremely dangerous. And with stigma, with feeling shame, with feeling like you're not accepted and you're not a part of a community, you use alone. And so for those parents who are afraid that their child is going to take something that someone else gave them, go up to their room, take it, fall asleep, and they find them dead the next day. That's scary. And it's because we're not talking about it. There's stigma involved, there's shame involved, and we're not open about it. It's extremely important that we talk, that we ask questions of our students, our children, our friends, about their use, about what they know, about what they're doing to protect themselves. Because it happens, it's going to continue to happen until we address it. Sean, can you talk a little bit more about the work you do out in the community?
Thank you, Dan.
Two minutes or so.
Sure. Sean O'Brien with Communities for Recovery. So yes, we are in an overdose crisis. We're in a fentanyl crisis. Fentanyl has found its way into more than fentanyl. Fentanyl is finding its way into a plethora of drugs. So people who are using drugs, and they are people, are finding themselves getting addicted to fentanyl without even knowing that they were using it. And from that, overdoses happen. And we have a medication, Narcan, that reverses overdoses. We need to get that into the hands of the people that need the medication, that are at high risk of overdose. In that community every day, I am an outreach worker and a harm reduction worker, working with people every day that want to be alive. They don't have the resources to be there, to get there. And that's why we're here asking for help, asking for your continued commitment to give us what we need. You know, peer support is a huge movement. They talked about it. Like, they trust me in those communities because I have lived experience with them. I'm an overdose survivor. I'm in active recovery from mental health and from substance use disorder. They trust us. So let us do our thing. We have a great opportunity here, and we're in a unique position to help this crisis and take it over. Thanks.
Thanks, Sean. All right. Well, thanks everybody for giving us thoughts on these numbers. I want to open up to questions now, and I know Dr. Pinkard's available. If maybe y'all want to start with questions for Dr. Pinkard about anything?
I'll open it up for
Okay.
questions, CBS. Thank you.
Yeah, I have a question, but it's about harm reduction. So I heard the fentanyl testing strips mentioned several times. Are there any specific examples of other harm reduction strategies you're looking to implement in the future?
Yeah, I think what you heard from Sean and Communities in Recovery is something that we've funded and obviously need to fund more of. I think that that's a great harm reduction strategy of people like Sean working with people who are dealing with this issue. It's a big one, getting fentanyl strips out there. And then the county has funded Narcan, putting Narcan everywhere possible, still very dedicated to getting it out in more places. I know the statistics that's not shown today is have been, Kate, I don't know the number, but hundreds of deaths prevented by Narcan in Travis County over the last year. I think I heard 500 reported.
I mean, just from our program alone.
Just from the work that Kate and team are doing in Travis County, 500 deaths were prevented by having Narcan accessible. So the numbers in this report indicate that we need to get that out to more places and more people.
Wow.
To the medical examiner, these numbers are extremely high. Have you seen anything like this, and why do you think the numbers are so high?
It's not just a matter of this year. This is a problem that's been brewing for several years. In fact, across the country, the trend started actually several years back in different geographic areas. It's now simply catching up with our region of the country in Travis County. Again, in the last 4 years, we went from 22 to 245 fentanyl deaths. That's a lot. It's over 100%, 108%. Why it's happening, I can't really explain. Certainly the increased prevalence of drug use throughout the country, and I think we're just now seeing what a lot of the rest of the country is seeing. Nothing unique to Travis County, though.
Okay, Jen.
Yeah, can you talk about the bill working through the legislature right now that classifies some overdoses as poisoning?
Certainly. Yes, there are a number of those such bills circulating. My understanding is that the intent of those bills is to facilitate the prosecution of manufacturers and distributors of illicit substances. We in the medical examiner community oppose that legislation primarily on the basis that it is attempting to dictate the practice of medicine, which we do not feel is appropriate. A cause of death statement or certification is a medical opinion that we do not believe should be legislated. But going back to the issue about prosecuting criminals, we have a similar situation that I can make a comparison to. For example, we see car accidents routinely. And in cases where, for example, one of the drivers is intoxicated, those cases are investigated and prosecuted despite the fact that it is not our practice to inject any air of criminality into a cause of death statement, because that is not what death certification is intended for. And so we oppose those bills.
Thank you.
Yes, I think this is probably for Sheriff Hernandez, but have we been able to trace back the fentanyl to suppliers here in Travis County?
We have a number of open cases that we're investigating in reference to fentanyl deaths.
Thank you.
Yeah, do you have any kind of breakdown for age? Because several local school districts have kind of been raising the alarm about overdoses among their students.
I don't necessarily have a breakdown in the age, but I will tell you what we're doing when we're going into the schools, when the sheriff's office is going into the schools. We're going in there with medical people and counselors and mental health people, and so we're not doing it alone, but there are a lot of schools that are sounding the alarm, and we are trying to with the many partners that we have, to educate not only the students but also the parents.
And yeah, I think the age, I believe, has gone down again. Do you know offhand? I know it's in the report, but if you could comment on the age.
So for fentanyl deaths, the peak is around the 21 to 40 years of age range. There's certainly some that extend out older than that. As far as younger deaths, last year there were 12 deaths in people 20 years of age and under.
And I think that's an increase, is it not, from
It is.
from 2021?
immediate impact or will be shut?
No, mine's going to be Spanish.
Okay, all right.
Okay.
Thank you all, appreciate it. If you all have any follow-up, please reach out to
And
your
I do have one other thing. I want to brag on Dr. Pinkard and his facilities here a little bit. So what the other drugs what's the other drug that you can test for that you haven't seen? Do you want to, just the facility here that we have in Travis County is amazing. There are lots of other counties that rely on the Travis County Medical Examiner to do testing. Their laboratory is top-notch, and it comes into play with this one example, if you don't mind talking about.
Certainly. So one of the things that you may have heard about in the news currently is another drug called xylazine. This is a drug that's not approved for human use. It's a sedative, analgesic in the veterinary realm. It has turned into a substance of abuse. It has now been seen in 48 of 58 states, and it is commonly seen together with fentanyl in either lethal or non-lethal overdoses. There was a cluster identified in West Texas a few weeks ago, I believe. Our laboratory, which, as Judge mentioned, is top-notch, we have had the capability of detecting that drug for at least 2 years, and we, fortunately, have not seen xylazine in any specimen from any autopsy case that we've done, whether it were to be the cause of death or not.
Thank you. Thanks, Doctor. Yeah, Commissioner.
You know, I think it's really important that we are working in the space of intervention, but we've got to work in the space of prevention as well. And one thing that we have seen with the judge's leadership is, you know, how do we begin to work in communities and how do we begin to work in schools? At the end of the day, we need safe places for our youth to be so that we can talk about things that are important. This is why after-school programs are so important, particularly in our Title I environments. You've got places like Manor, you've got places like Pflugerville, you've got places like Del Valle, where you have very limited after-school programs. We need safe places for our children to be between the hours of 3 and 7. We need to make sure that we have access to tutors and mentors, access to third meals, access to the type of programming that will give them information about what's going on here. We've also directed more mental health funds through Integral Care into our middle school and high school spaces. There is no magic bullet. We've got to work on prevention as well as intervention simultaneously. And ultimately, it is only when we cover all of that ground that we give our children a legitimate fighting chance because they have information and the tools that are necessary to intervene and help them.
Thanks.
All right, thank you all for listening. If you need anything else.
Thank you very much. Thanks for covering this.
Thanks for being with us on KXAN Live. I'm Will Dupree coming to you back from the KXAN Live studio. As we've heard those new numbers related to fentanyl overdose deaths in Travis County last year, we are seeing an increase in those from 2021. I want to just really quickly pull up the numbers that they mentioned a few moments ago. The medical examiner's report chronicling and detailing some of the deaths that happened in Travis County last year are being released today. And in that report, it says that last year, 245 people died from a fentanyl accidental overdose. And that is the majority of the accidental overdose deaths in total. So 245 of the 417 are connected to fentanyl. And they are talking about some of the different efforts to try to combat that, whether it is through some sort of campaigns and educational resources put out there, as well as some of the law enforcement investigations that are happening into where this fentanyl is coming from in the community and cracking down on that too. So we are going to detail and look through that report. You can find it on our website, kxan.com, a little later today as we get some more of those details, but just wanted to share this live news conference there from the Travis County judge and other leaders in our area talking about this situation. As they said, this ongoing health crisis is still happening. Thank you all again for watching here on KXAN Live. I'm Will Dupree in the KXAN Live studio. We will see you back here at another time. Hope you all stay safe and healthy out there. Take care.